everyone, my name is Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom. Today we're going to be talking about some of the most common things we hear about sleep and deducing. That's a weird word. Today we're going to be talking about some of the most common sleep training assumptions we hear when it comes to baby sleep and determining if it's true or false. Alright guys, before we get started, if you have any questions below, make sure you ask them in the comments. We'll hit on them in future videos. If you find this content helpful, make sure you hit the subscribe button. If you just want to learn a little bit about sleep training and busting some common myths, just listen on for more. So the first one, let's talk about sleep training generally. It takes babies months to sleep train. True or false? False. It might actually just take your baby a few days or maybe even weeks. Babies don't necessarily need months to learn how to sleep. Generally, what I recommend is making sure you pick up on your baby's sleep cues. Just like you need to pick up on their hunger cues before they get over hungry or hangry, you need to pick up on their sleep cues before they become overtired. What are the signs of an overtired baby? I'm going to link an old video up here. You can always watch it and learn what are the common signs that we see for an overtired baby and why it's so important to try to avoid having your baby be overtired. You want to essentially create a good routine for your child. So when you pick up on those sleep cues, make sure you try to pounce and get your child to bed on time. A good routine is so important. So that means when it comes to getting them ready for bed, maybe you need to change their diaper, maybe you swaddle them up, maybe you read them a book, and actually right now my children's bedtime story, It's Time to Say Goodnight, is running for a special offer. If you click on the link below in the show notes, purchase the book, and DM me a picture of the receipt on Instagram, you'll be entered into a free sleep consultation with me. Now, when it comes to setting up a good routine, trying to stay consistent is a great way to really ease your way into sleep training and help your child be able to self-settle or self-soothe themselves when it comes to going to sleep. On that note, what about babies needing complete quiet to go to sleep? This is also false. There's actually a lot of noise that babies can hear in utero. Rumbly, muffled noises. So generally, I actually recommend a white noise machine. Another reason why the white noise machine is so great is that you don't always have to worry about pin drop silence when you're putting your child to sleep. As a mom to two now, I've really began to appreciate my white noise machine. We actually use two. If you are curious about which white noise machine we use, make sure you comment or ask below. I'd be happy to explain more and talk about my particular favorites when it comes to picking a white noise machine. What about this one? Never wake a sleeping baby. True or false? This one's also false. In a certain situation. When your child is very young, they actually might be losing a certain amount of weight. This is normal, especially in the particular initial newborn days of life. That's why it's so important to wake your baby regularly to feed so we get those calories in and they can regain their birth weight. Once your baby has regained birth weight and you're not necessarily concerned about weight gain, from your pediatrician standpoint, if they say it's okay to let them sleep longer stretches at night, it's totally fine to let them sleep longer stretches. But that means during the day, you need to stay regular about waking up your baby because you want to try to get those daytime calories in. Otherwise, if your baby's not really meeting their calorie quota or getting enough milk in or formula in during the day, they're going to be waking up at night. Generally, I say you should definitely try to wake up a sleeping baby during the day if you can, because that's the times that we want them to be awake, right? We want them to sleep longer at night so that we can get some sleep. On that note, is it true that if you put your baby to bed later, that they will wake up later? No, false. This is actually going to backfire for most parents who try to do this. Generally, children have a normal wake window somewhere between 5 to 7 a.m. and you're going to try to hopefully push that to 6 to 7, and that might be pretty normal. You really can't make them sleep in later. Generally, I tell parents that if you put a baby to bed at 9 p.m., they're going to wake up at 6 a.m. And if you put a baby to bed at 11 p.m., they're going to wake up at 6 a.m. So what you want to try to do is get them to bed a little earlier. In fact, you might even find that putting them to bed earlier makes them sleep longer. I know that doesn't really make much sense, but just bear with me here. This is normal newborn sleep physiology. I can tell you on my own accord with my daughter, I don't really remember my oldest daughter, but right now I have a 2-month-old, and I really distinctly remember that while we were trying to work out the kinks of a good schedule, she was initially going to bed close to 9:30. And she would just lay in bed and not necessarily cry, but she would coo and take some time to go to sleep, and it would take almost 45 minutes to an hour. And then yes, by that point, she would start to cry and be a little hungry because it was the initial newborn days where she needed to be fed pretty frequently. Fast forward a few weeks, we get into a good groove, and I was finding that even if I put her to bed 1 hour earlier, closer to 8 p.m., boom, magic. I was getting her sleeping longer stretches at night. So this is really real life. Babies, if they actually go to bed earlier, will actually sleep better. What about having them sleep longer stretches? Do dream feeds help? True, but with a caveat. Dream feeds might help some babies, but not all babies. So some babies might respond very well to a dream feed. And to explain what a dream feed is, you're actually just, after you put your baby down to sleep, let's say you put them down at 7 p.m., you dream feed them at 9, 10, 11 p.m. before you go to sleep so that you can buy yourself a couple of extra hours of sleep. Now this might be a great option for you, especially because you're able to feed your baby without having them really wake up and disrupt their sleep cycle, and also get a longer stretch of sleep yourself. The caveat here is you might find that it does disrupt their sleep cycle. So you can really start dream feeds pretty early for a baby, but if you're finding that it actually is backfiring and your baby's sleep is a little disrupted, or they're rousing and they're having difficulty going back to sleep, then maybe you hold off on dream feeds for a little while. They're not meant for everybody. So if you are finding that's happening to you, you can hold off and try it again. The goal here with the dream feed is actually trying to keep your baby a little bit more asleep actually during the feed, and just feeding them through their sleep and getting those calories in. So of course, sleep hiccups happen. So let's talk about sleep regressions. Are sleep regressions a myth? False. They're not a myth. These actually do happen. They happen pretty frequently actually, especially as your child gets older. I want you to think back to yourself as an adult. When you go out of town, or you're staying over at a friend's house, or you're in a hotel, is your sleep a little different? And then when you come back home, it takes you a little bit of time to adjust perhaps. So everybody goes through some regressions. You can have sleep regressions when your child's traveling, when your child's ill, when your child's teething, all these different things. When there's something new in your house, maybe your child's starting school or there's a new sibling, sleep regressions are very normal. They're not a myth. And how you approach your sleep regression is really going to dictate how that regression really plays out. So if you try to go back to the normal routines and revisit the same behaviors that you did when you initially sleep trained your child, then your regression shouldn't last long. But if you try to change things up, for example, your toddler starts regressing after they start school, and rather than going back to the way you really sleep trained them initially, or trying to revisit the same routines that you had in place, you allow them to start coming into bed, then yes, your regression is going to last longer and it's going to be harder to undo those behaviors. Speaking of sleep regressions, true or false? All babies go through a 4-month sleep regression. False. Generally, just a hint, even when it comes to taking tests, anytime you see all or nothing questions or always, usually that's false, because not everybody follows a rule book. So not every baby follows a rule book. Your baby may have a 4-month sleep regression. It may or may not occur always at 4 months. If you want to learn more about a 4-month sleep regression, make sure you've watched my prior video that I've done on it. I'll link it right here. We go through a lot of common questions about the 4-month sleep regression, what's happening, how to get through it, and the best way to set you and your baby up for success when you're going through it. The 4-month sleep regression may or may not happen at 4 months. It could happen closer to 3 months. It can happen closer to 4.5 or 5 months. And again, how you approach that sleep regression is really going to dictate how well you come out of that regression. All right, that's all I have for you. If you found this video helpful, give it a thumbs up. And again, you can subscribe below if you find this content interesting. We talk not only baby sleep, but we talk parenting and pediatrics on this channel. So we'd love to have you. I'll see you guys next week. Bye.